how to conceive easily. Infertility is on the rise and millions of people are struggling to conceive these days. Furthermore, people are delaying their pregnancies for professional and economical reasons. We all know urban lives with their poor diets, sedentary lifestyles and high levels of stress add to the flames. So hi there, I'm once again Dr. Deepti Asthana. I'm Senior Consultant in Fortis Hospital, Gurugram and Director of Kalosa Gynae. I'll talk about a very basic approach to get pregnant easily, and stay tuned till the end if you too are facing problem in conceiving or you are thinking of expanding your family. You can log on to my websites www.drdeeptiasthana.com or www.kalosaaesthetics.com for any gynae or cosmetic gynae related issues. Please also subscribe to my channel Kalosa Gynae, where we'll talk about everything related to female reproductive health, right through adolescence to menopause. Ironically, people who don't want to get pregnant quite quickly, whereas those who actually want to get pregnant, they struggle. Today, I'm going to share few advice with you to help you achieve pregnancy with ease. So let us begin with the series on infertility with a very basic issue of how to improve your chances of getting pregnant. Now, how to get pregnant fast. As a couple, you may have spent many years trying not to conceive a child through sexual protection, but now when you actually decide to get pregnant and want it fast, it doesn't occur. Is it true with most of you? Well, it is important to remember that pregnancy can take time, even if all the related parameters are fine in both the partners. It is estimated that a healthy 30-year-old woman has only 10 to 15% chances of becoming pregnant in any given month. Therefore, as a couple, you should not take stress even if you're not pregnant in the first go. Many patients come to me with a worry that when my menses are regular, why I did not get pregnant in 2 or 3 months of trying. I always tell them to relax and keep trying. Now here are some basic steps you can take to begin the process. Number 1, make sure you have regular intercourse. See, keeping a track of your ovulation period during your menstrual cycle is important. For your knowledge, ovulation is the time when the egg from your ovary is mature enough and released by the ovaries. Tubes quickly grab it and transfer it towards the uterus for mating with the sperms. Having intercourse regularly around that period is important. Also, keeping stress aside for those important days is essential. Stress could be due to professional work or performance pressure, but any kind of stress usually worsens things. So relax and enjoy being together instead of being under pressure. Now withdraw any birth control measures in advance. In the case of birth control pills, its hormonal effects may not be long lasting and you will be able to return to your regular menstrual cycles very quickly. If you use an intrauterine device, make sure you have the device removed by a healthcare professional to restore your fertility. The effects of Depo-Provera may be more long-lasting. Therefore, to increase the chances of getting pregnant, stop taking the shots at least few months before trying to conceive. Now, you should know the best time to conceive. As already discussed, the best time to get pregnant is during ovulation. Although sperm can survive up to 48 hours after sexual intercourse, a mature ovum can survive only 12 to 24 hours after ovulation. This means that the female ovum can be fertilized within 12 to 24 hours after release. Therefore, to increase your chances of getting pregnant, it is best to start intercourse approximately 2 to 3 days before ovulation. This ensures that when the egg is finally released, there is enough sperm in the fallopian tube to fertilize it. Now, predicting when your ovulation will occur can be extremely helpful in conceiving your baby. If a woman is within the average 28-day menstrual cycle, ovulation occurs only once and usually occurs approximately 14 days before the onset of next cycle. However, women with exact 28-day menstrual cycle fall into the minority, as most women have menstrual cycle between 24 to 35 days. Now, since ovulation occurs 14 days before your next menstrual cycle, this means that it can occur on the 10th day for a woman with a 24-day menstrual cycle and on the 21st day with a woman with 35-day menstrual cycle. Now, women with regular menstrual cycles can use a device like ovulation calculator to get an ovulation time per month. In addition, there are some kits available in the market which can check your hormone levels. But women with irregular period should and always go for follicular monitoring so that they can exactly say when their ovulation is going to take place. Now, ensuring good health prior to conception is very important. When patients come to me for infertility, I always tell them, before you even try to conceive a baby, as a couple, you both need to be in good physical and mental health. So wherever you are, try to make an appointment with an obstetrician to discuss a health problem, get a preconception counseling done and test done, and find out if you have any genetic disorder. In addition, your doctor may recommend some lifestyle changes which may increase your chances of getting pregnant. Make sure you are checked for rubella antibodies too in the females. Thyroid levels in female partner are important and should be corrected before conception. Now, the upper limit for TSH in pregnancy is around 2.5 to 3. So make sure you actually achieve that prior to getting pregnant. Now, any other medical condition which is uncontrolled should be controlled before conception, which will include diabetes or blood pressure. If you have had COVID infection in the past, your doctor may prescribe some supplements to ensure that you get back in good health. Get semen analysis done in case you had severe COVID infection, as sometimes it affects your sperm quality and quantity too. You should always maintain a healthy body weight and lifestyle. Eat a balanced diet, which should include whole grains, fish, vegetables, which can improve your male fertility. Foods rich in vitamin C can increase sperm motility, and other high protein diets should also be taken. In addition, lower levels of vitamin B should be corrected to increase the sperm health. Men should avoid hot tub baths and should not carry any electronic devices such as laptops in their laps, which can raise the temperature of the testicles and impair sperm production. Also, de-stressing yourself daily goes a long way in maintaining the positivity and keeping you optimistic. This may be through yoga, exercising, swimming, dancing, whatever form you want to choose. I always tell my patients to do these exercises with your partner. Spending time together helps in bonding and de-stressing both. If you're obese and overweight, try to decrease the weight and achieve a desired BMI preconceptionally. Being overweight may also predispose you to gestational diabetes and hypertension later in pregnancy. So putting little efforts in preconception period is worth it. Next, gradually decrease any addiction. We all know any unhealthy habits such as smoking and alcohol use should be avoided in order to conceive a healthy baby. But I have found that there's always lack of motivation. One of my patients only left smoking when her unborn baby had decreased blood supply at an early gestational age. That was a do or die situation for her. So it is always better to leave them early. Taking regular doses of folic acid can increase your chances and reduce your baby's risk of any neural tube birth defects. You should maintain a limited amount of daily caffeine intake. At the end, most important is stay positive and see a qualified high-risk obstetrician. I've seen many patients getting depressed early and changing doctors frequently. It is wiser to choose a good doctor initially and trusting them rather than changing them frequently. If you're not able to conceive naturally in the next 6 to 12 months, do visit your doctor for detailed workup and further treatment. Hope you gained some knowledge through this video. For regular updates, please subscribe to my channel Kalosa Gynae and follow us on Instagram. You can also visit my website www.drdiptiasthana.com. Thank you and take care.